I've got to start off by thanking three people. Mr. President, thank you very much. God bless you for leading our nation, but also courageously leading the MAHA movement, really earnestly in your heart wanting to get America to be healthy again, and for giving me an opportunity to help with that mission. Secretary Kennedy has been leading the charge at Health and Human Services. A dear friend, like a brother, has done unbelievably courageous work because he's curious and he's started answering a lot of important questions. And I will treasure for the rest of my days your trust in me to help you with this progress. Thank you. And of course, Lisa, the family, but Lisa in particular, who's had an uncanny ability to identify opportunities and to always keep a clear North Star to keep our family grounded. God bless you, my beautiful one. Let me start with a simple premise. Every great society, everyone, has an opportunity to take care of its most vulnerable and treasures that opportunity. And we're great people, so we will do the same. As we entered the main building, the Humphreys building, where Health and Human Services is located, there's a placard of Hubert Humphrey, and it says that it's a moral opportunity, a moral obligation of government to take care of people in the dawn of their life, the kids, in the twilight of their life, the elderly, the mature, the seniors, and those in the shadows of life, those struggling with disabilities. We want to provide America with access to great care. We want to save the public health insurance programs of this country. That's what President Trump asked me to do when he took this position to administer the programs at CMS. Now, if we're going to do that, you've got to be honest with each other. And a physician, President Trump, has to always do that, right? We've got to share news, sort of presidents, that folks don't want to hear, but it's important for our well-being. So I'm going to give you 4 bullet points to remember. Bullet point number 1, and they're all numbered in order for a reason. Medicaid is the #1 budget item for many states, and it is crowding out education and other important social programs. The states are having a big problem, and that's with the federal government paying most of the bill. Item number 2, healthcare expenditures are increasing at 2% higher than the economy is growing. And because of that, we spend more than 2 times per person on healthcare than any other country on the planet, and we're not getting value for that. Because number 3 is that we are, in America, experiencing an unfortunate problem, which is medical errors are the number 3 cause of death. Did you know that, Mr. President? It's surprising with that much money invested, we're still having problems. And number 4, our life expectancy, despite all this investment, is continuing to slip back. We're now more than 4 years shorter in our life expectancy than countries that we used to be equal to. But I am optimistic. Why? Because we control our destiny. Because at its very core, we have a generational opportunity, a unique ability to save the healthcare system because we control all the big pieces. America is too great for small dreams. So I've got some big ideas that I'd like to share that we've worked through with my staff who are cordoned off over there, and there's a lot of us. We've got almost more than 6,000 people at CMS working on this and 40,000 contractors helping. So we've got a lot of people. What are we going to do? First, we're going to reduce chronic disease. How do you do that? 70% of the healthcare expenditures of this country are driven by chronic disease. And it is your patriotic duty, I'll say it again, the patriotic duty of all Americans to take care of themselves because it's important for serving in the military, but it's also important because healthy people don't consume healthcare resources. The best way to reduce drug spending is to use less drugs because you don't need them because you're healthy. And it feels a lot better as well. The President and Secretary Kennedy have been pushing the MAHA agenda because it makes it easier for people to do the right thing, especially the mothers of this great land, because they're the ones who really get caught with this responsibility. They're the ones deciding for their kids. They're the ones we want to empower. And curiosity, which is the key word here, truly asking questions you want the answers to, will allow the MAHA movement to thrive. The next big thing we want to focus on is modernizing Medicare and Medicaid. That's how Americans will get the care that they want, need, and deserve. We need to empower patients and providers, both. The doctors and the patients both have to be equipped with better tools. And the President is showing that he actually does love and cherish Medicare with all these executive orders, like the one on transparency, sir, that really helps us by making sure people are equipped with information. So you shine a light in the dark shadows where so much of the problems happen with the healthcare system. And remember, the most expensive care is bad quality care. That's what we want to stamp out. And finally, we want to crush fraud, waste, and abuse. This is stunning to me. And I've got a message for all the bad guys from me, the Secretary, and the President. We are going to stop people from stealing from our most vulnerable, from stealing with the taxpayers of America or honestly trying to support these programs. And we're going to be able to do it in quite a few ways. We are coming for you. And I'll give you a couple examples. Mr. President, these are ones that you may want to use in some of your future conversations. Almost 250,000 people, American citizens, were fraudulently enrolled without their knowledge in exchange programs by brokers who were unscrupulous, stealing from the U.S. government by pretending these people were on programs they never told them about. Tens of millions of dollars, Mr. President, are being spent on illegal immigrants receiving Medicaid in California, and they're pushing the bill to us. Should we stop that? I think so. That will not continue. We're spending about $1 billion on Medicaid programs for dual state eligible patients, which means you live in one state, but the system thinks you're another state, and maybe a third state, and we're paying all 3 states for services you're not getting because you don't live in 3 states all at once. And finally, and this one really bothers me, there are states who are using Medicaid dollars for people who are vulnerable are being used for non-medical purposes. For example, public labor unions are getting child care through some of this money. That doesn't make sense to me. Housekeeping, I wish I could get that for my home. There's a big problem with student loan repayments taking place with Medicaid dollars. That's not where it should be used. And we are paying for DEI programs. I could go on, but these are all programs, Mr. President, that we have created a war room at CMS to go after, to catch the fraud in real time before the money leaves the federal coffers, so we have the money to reinvest in healthcare to make it even stronger than it's been before. Together, we're going to make the care better. We're going to make the outcomes improve, and we're going to make sure that America can actually be the healthiest country that could ever possibly be. We'll make America healthy again. God bless you both, sir.